So I will present the CAD system for detection of brain tumor based on MRI. So our group member is Nagaling Keswaran, Nur Aina, Aisha Auni, and the lecturer's name is Dr. Wan Mahani Hafiza. My name is Nur Aina. So this is the causes of the condition that use in the MRI, which is the small stroke, multiple sclerosis, infection, migraines, and brain tumor. But today, on this project, we will focus on the brain tumor. So, a brain tumor is a mass, unnecessary, and abnormal cell growing in the brain, or it can be defined as an intracranial lesion. This intracranial lesion, which occupies space within the skull and tends to cause a rise in intracranial pressure. So this brain tumor can detect by computed tomography CT and magnetic resonance imaging, which is MRI. So the purpose of the CAD system of MRI is to detect brain tumor, so the medical specialist will have a fast solution to recover the patient. So basically this CAD system helps to identify the brain tumor and the condition of the brain patient itself. So the MRI allows to clarify the various tissues and to obtain a 2D, 3D, and even 4D of a part of a body, in particular of the brain. So MRI, it is based on the principle of nuclear magnetic resonance, and it is most widely used as a clinical diagnostic and research technique. So the problem for the use of MRI, as the process of the separation is very important. Many medical imaginary diagnosis system has to face the problem to separate nuclei separation from the rest of the image content. So as the process of separation is very important, much attention required in the construction of the aspect diagnosis system has to be paid for the segmentation stage. So the problems is they need to overcome the blurry and grainy MRI, which causes error in detection tumor, and the presence of small tumor, which is difficult to detect. So the image that is appear, which is there is a brain tumor in the brain that is slightly small, so it is hard to detect. So the MRI do their job.
Assalamualaikum. We present the methodology. So this is our block diagram for the project. First, input brain MRI image, pre-processing, filtering, thresholded image, watershed segmented image, tumor detected, and the last one, output image. For the flowchart, we start with input the image with taking a collection of image from dataset. Images are stored in MATLAB, will be displayed as a scale image. Then pre-processing stage. Pre-processing is the image is utilized to improve the chance of finding the suspicious lesion in the second step of image processing. The purpose of pre-processing is to reduce noise and boost contrast in order to improve the image quality. After that, filtering. Filtering is a method of altering or improve an image. The noise in the supply image is removed in this step. Then applying threshold. Threshold image is based on a simple segmentation technique in which a grayscale image is first converted to a binary representation. Applying watershed segmentation image is exceptional. It is a morphological working tool used in science. Tumor detection. Tumor detection highlighting the area of the tumor. Only tumor image. The tumor image will be displayed on the monitor. And end.
I'm Naga, so today I'm going to talk on stimulation of CAD system for detection of brain tumor based on MRI images. So this is the main MATLAB coding that our group have used to stimulate MRI images. So we have started with clear all close on LCLC, and this first three command is basic for MATLAB as we are clearing the workspace, close all the figures and clear the command window as well as reset the MATLAB to get a better output. Next, in line 7 we have started with our coding where image data is we have to input our file name, which MRI image we want to stimulate to get a output. And from line 12 we have started with our first stimulation where the line converts grayscale image to binary image and converts true color image RGB to binary image as well. And this image system is our first thresholded image. Secondly, we will go to line number 20 where we have used edge detection. In this edge detection, got three steps where noise reduction, edge enhancement and edge localization. And together with Sobel filter, we have used for edge detection by calculating gradient of image intensity within image. Later on, from line 25 to and so on, we have applied process of watershed segmentations. At this point, we have achieved some degree of segmentation and varied Stirl function. And from line 35 and so on, we have performed morphological opening on grayscale or binary image so that we will produce a tumor only image which highlights the only tumor, and finally we will get the output. Then there will be 4 figures listing out as we have mentioned the title here. The first figure will be named as brain MRI image. The brain MRI image will be our first output of our real image. Secondly, it will convert the image to binary image, and using median filter and RGB gray, it will produce a thresholded image. Later on, with Sobel functions and all, we will be getting figure 3 with a watershed segmented image, and finally we will be getting a only tumor image which will detect the tumor from the brain. If in case there's no any tumor, the final image with the tumor will be shown total black spot. There won't be any white spot. Only tumor appears with white spot. Okay, next we will try running our code and we will get to see our output. So before running the output, we have to input a file name, and we have selected 5 different files of brain which contains tumor, and there's one more file number 6 which does not contains any tumor on the brain. So we will select file 1 which names as 1 and we will input the file name, and we will run the coding as well, and this will be our output for our coding. So there's 4 different figures as an outcome, and the first figure will be brain MRI image where our real input image will be shown. Secondly, our thresholded image will be shown as the tumor, the tissues will be shown in white color and the other spots will be in black color. Thirdly, the watershed segmented images, it will be in colored form. And finally, we can see the tumor which is in white color and the other spots are in a black color. Wherever tumors are appeared on the brain, it will be shown as a white spot. As a final stimulation, we have designed an application in MATLAB to produce a MRI image of a brain tumor with the app application, and this is the application that we have used, and we have inserted our title CAD System for Detection of Brain Tumor based on MRI images for our group. and there will be 4 images displayed, and the first image will be our MRI image that we're going to input, and the next image will be the expected tumor that we want to see the tumor. Third will be the watershed segment, and the final one will be a thresholded image. So we have connected our application together with our previous coding together. So first we will try run the application and we will get to see our output. So this is our application. Firstly, we have to browse for the image, and once we have selected an image, the image will appear on it. Second, when we want to see the tumor on the MRI image, we have to press the button process, so we get to see the expected tumor. And third, we have to generate the watershed segmented image where we can see the watershed segment image. And finally, to get the thresholded image, we have to press the generate again, so that we will get a thresholded image again. So this is the way of using applications. Compared to the coding, it's easier and simple.
In conclusion, the medical processing is currently the most complex and developing field. The initiative makes MRI image analysis accessible to a wider range of people who do not need to be expert in the field. MRI image is a safer alternative to X-ray. This project has the potential to speed up and reduce the cost of MRI image processing and tumor detection. The objective to detect if there is a tumor in a specific MRI image scan of the brain has been accomplished. The application effectively detected and indicated the tumor site by highlighting the area if the tumor exists.